So today, we're going to dive into a pretty incredible story. It's all about how modern medicine can step in after a minor stroke to stop a much bigger one from ever happening. We're going to look at this fascinating field of stroke prevention and some amazing tech that gives people a second chance.
And this is the big question, right? For a lot of people, recovering from a minor stroke feels like, okay, crisis averted. But what if it's not the end of the story? What if it's actually a warning sign, a signal that something way more serious could be just around the corner if you don't find the root cause?
All right, so let's meet the person at the heart of our story. We're talking about an elderly woman who had a minor stroke. And the good news is she made a full recovery. You'd think on the surface that the danger had totally passed.
But, for her doctors, that recovery wasn't the end of the story, not by a long shot. For them, it was really just the beginning of an investigation. They had to figure out why that stroke happened in the first place, so they could prevent another one that could be far more devastating.
So they started digging. And what they found? Well, it was the real culprit. A super serious, life-threatening problem that was just hiding in plain sight.
The diagnosis was something called carotid stenosis. Now, the easiest way to think about this is to imagine your carotid arteries as these two major highways, one on each side of your neck. Their job is to get all the essential blood and oxygen up to your brain. Well, stenosis is when one of those highways gets dangerously narrow, and it creates a massive traffic jam.
And for this patient, the situation was, it was critical. One of those super important highways to her brain was 90% blocked. I mean, can you even imagine that? Just a tiny little trickle of blood was getting through a pipe that should have been wide open.
And take a look at this. This is exactly what the doctors saw. It's an angiogram, which is basically an X-ray of the blood vessels. You see that really severe pinch right there? That's the 90% blockage. It's literally a ticking time bomb, putting her brain at extreme risk for a massive stroke.
Okay, so you've got this major highway to the brain almost completely shut down. How in the world do you fix that? Well, the answer is this incredible, minimally invasive procedure called carotid angioplasty and stenting.
The whole thing is just amazing, really. First, the doctors guide this tiny tube called a catheter all the way from an artery in the leg or arm, and they navigate it right up to the blockage in the neck. Then comes this really clever part. They deploy a tiny filter that acts like a safety net. And finally, they put in and expand a small mesh tube, that's the stent, which just props the artery open.
See that little basket thing? That's the embolic protection device. And its job is, it's absolutely crucial. While the doctors are working on that blockage, this little safety net just sits downstream, catching any bits of plaque or debris that might break loose. This is what keeps that stuff from traveling up to the brain and causing a stroke right there during the procedure. It's brilliant.
Now in this case, the team used a really advanced piece of tech called the C-Guard stent. What makes it so special is this unique dual-layer micronet design. It's built not just to prop the artery open, but also to trap any potential debris, making sure that highway stays clear for a long time. So, after they navigated to the blockage, deployed the safety net, and placed the stent, what happened? Was the highway to the brain finally clear?
And here it is. This is the aftershot, the post-procedure angiogram. And the difference is it's night and day. That artery now has a normal, healthy width. It's a wide open path for blood to flow freely to the brain. The immediate danger, it's gone.
But really, this side-by-side tells the entire story in one glance. On the left, you see that terrifying 90% blockage, that severe pinch. And on the right, just look at that, a healthy, wide-open artery. It's just an incredible visual of how this technology can completely prevent a future disaster.
This is an amazing success story for one person, for sure, but it points to something much bigger. A really important lesson about how we all should be thinking about stroke treatment.
And this really gets to the heart of it all. Treating a stroke isn't just about surviving the first one. That's only half the battle. Real comprehensive care means looking forward. It's all about being proactive, about preventing the next one, to make sure a minor stroke is just a one-time warning and not a preview of something way worse.
And that leaves us with this really powerful final thought. For patients who've already had a stroke, preventing the next one is just as important as treating the first. It's a simple idea, but it totally shifts the focus from just recovery to building long-term resilience.